Age-related macular degeneration is a deterioration or breakdown of the eye's macula. This condition is caused by aging and thinning of the tissues of the macula, and the macula is a small area in the retina that is responsible for your central vision, allowing you to see clearly fine details. Now, with macular degeneration, you may have symptoms of blurriness, dark areas of distortion in your central vision, and perhaps permanent visual loss of your central vision. Now, it usually does not affect the sight or your peripheral vision. For example, with advanced macular degeneration, you could see the outline of a clock, yet may not be able to tell what time it is. So you lose the sharp central vision. You need to read, drive a car, or watch a movie. In some people, the macular degeneration advances so slowly that the vision loss does not occur for a long time. In others, the disease progresses faster and may lead to loss of vision in one or both eyes. There are two types of macular degeneration, the dry and the wet. And the dry type can also be called atrophic macular degeneration. It usually begins when tiny yellow or white pieces of fatty protein called drusen are under the retina. Eventually, the macula becomes thinner and stops working properly. So the other type is the wet type. And about 10% of the people who have macular degeneration have the wet type. But it can cause more damage to your central vision or detailed vision than the dry form. The wet macular degeneration occurs when abnormal blood vessels begin to grow underneath your retina. And these blood vessels grow from the layer under the retina called choroid, and that's why it's called choroidal neovascularization. Now, these new vessels, they may leak fluid or blood, and the vision loss may be faster and more noticeable than from the dry type of macular degeneration. So the longer these abnormal vessels leak or grow, the more risk you have of losing more of your detailed vision. Also, abnormal blood vessel growth if it happens in one eye, there's a risk that it will occur in the other eye. So the earlier the wet macular degeneration is diagnosed and treated, the better chance you have of preserving much of your central vision. So that's why it's so important that you and your ophthalmologist monitor your vision in each eye carefully. Your child can inherit your macular degeneration. Recently, much new information on macular degeneration has been discovered, and genetic changes appear to be responsible for approximately half the reasons for individuals getting macular degeneration. Now, additionally, there are other risk factors for developing the disease. The major risk factor is age. Many older people develop macular degeneration as part of the body's natural aging process. One large study found that the risk of getting macular degeneration jumps from 2% of middle-aged people in their 50s to nearly 30% in people over their age 75. Now, the major risk factor for developing macular degeneration is age, but also smoking and race. Caucasian is more common among Caucasians than among African Americans, but also family history. And other risk factors include poor diet, lack of exercise, high blood pressure, and overweight or obesity. Now, first, always have a routine eye exam in order to detect changes earlier. The earlier the wet macular degeneration is diagnosed and treated, the best chance you have of preserving some or much of your central vision. Number two, manage other diseases. For example, if you have a cardiovascular disease or high blood pressure, take your medication, follow your doctor's instructions for controlling the condition. Third, do not smoke or stop smoking. Ask your doctor to help you to stop. Now, fourth, maintain a healthy weight and exercise regularly. If you need to lose weight, reduce the number of calories you eat and increase the amount of exercise you get each day, but maintain a healthy weight by exercising regularly. Much easier. Now, fifth, choose a rich diet in fruits, vegetables, and leafy greens. These foods contain antioxidant vitamins and that reduce your risk of developing dry macular degeneration. So eat kale, spinach, broccoli, peas, and other green leafy vegetables so you increase your level of antioxidants. And they also include lutein, zeaxanthin, which is important. Now, sixth and last, include fish in your diet. Omega-3 fatty acids, which are found in the fish, may reduce the risk of dry macular degeneration. Nuts also, such as walnuts, they also contain omega-3 fatty acids. Very important, taking the ARED supplementation do not prevent the development of macular degeneration. So the age-related eye study show that taking AREDs do not prevent people from developing early signs of macular degeneration. So no recommendation has been made to take AREDs to prevent early AMD, macular degeneration. Now regarding vitamin supplementation, people who are at high risk for developing advanced macular degeneration should consider taking the ARED supplementation. So your eye care professional can tell you if you have macular degeneration and are at risk of developing the advanced form of the disease. So before taking this high level of vitamins and minerals, you should talk to your doctor about the risk of developing advanced macular degeneration and whether you should take AREDs and if it's right for you or not. Also, patient asks me, can I take AREDs and multivitamin? And I always answer yes. A daily multivitamin contains many important nutrients that are not found in the AREDs formulation. For example, elderly people with osteoporosis, they need particularly be concerned about taking vitamin D for the osteoporosis, which is not in the AREDs formulation. The AREDs formulation is not a substitute for your multivitamins. Regarding the aspirin use, at this time, there is insufficient evidence to prescribe or not prescribe aspirin for its potential effect on developing or progression of macular degeneration in most patients. So, as ever, decisions about aspirin should be made with your doctor, balancing risks against benefits in the context of each patient and risk profiles, and you should use your physician advice.